A warm welcome, dear viewers, to Swiss Health Television. Today I have two remarkable doctors with me, Dr. Harald Burgard and Dr. Sascha Dörrmann. And today they will tell us how rejuvenation works from the inside and the outside. And I find that remarkable because we don't just look at the exterior, but also consider what our health needs so that we look young and fresh. I hope you join us for the conversation. Stay tuned. Hello, dear Harald.
Hello, Silvia.
Hello, dear Sascha.
Hello, dear Silvia.
Great, I'm really looking forward to you. But to start, perhaps, Harald, can you briefly explain how you came to collaborate or what it's all about with you?
Mit euch auf sich.
Yes, Silvia. So for our viewers, a brief explanation. I am a doctor and have been dealing with holistic medicine and detoxification methods for 20 years, particularly those that can demonstrably be seen to work. And in order for as many people as possible to benefit from such therapies, we have created a cooperation platform as MedSelect GmbH, where we bring together people, specialists who offer these things, who provide professional detoxification options, toxophoresis. And Mr. Dr. Dörrmann from Switzerland is our first partner here in your beautiful country. And he will now touch on the interesting aspect of reporting today on how internal detoxification also affects outer beauty.
Wonderful. Dear Sascha, I am looking forward to the conversation with you later, and I bid farewell to you now, Harald, and look forward to next time with you.
Freue mich auf nächstes Mal mit dir.
Very gladly.
Dear Sascha, it's great that you have made your way to us today. For me, it is a special pleasure to meet someone who also works in Switzerland with the toxophoresis. For me, it is, of course, very exciting, and also for the viewers to learn how you, as a plastic surgeon and aesthetic specialist, came across toxophoresis in the first place and how you work.
Auf die Toxophoreese gekommen und wie arbeitest du?
Thank you very much, dear Silvia, for the invitation. I'm also very pleased to be here. Well, it so happened that after studying medicine, I specialized in certain areas. I was in plastic surgery for 6 years, also did my doctorate, the doctoral thesis there, and then devoted myself to other specialized fields and then completed the specialist training in anesthesia with intensive care and emergency medicine. And then after my work at various renowned clinics, I worked at the University Hospital in Freiburg in Germany, in Innsbruck in Tyrol, and then at the University Hospital in Zurich as a senior physician. I became self-employed and specialized in external and internal rejuvenation as a holistic concept. And how it came about that I offer toxophoresis, of course, has the following background. During my work as an intensive care physician, I was already early on involved with hemodialysis, with hemofiltration methods in the intensive care unit, and came into contact with them. And now, of course, this holistic concept in the figurative sense means the beauty from within, the removal of all the environmental pollutants that every human being inevitably accumulates throughout their life in our current situation. Zu entfernen. In combination then with the beauty from the outside. Schönheit von außen.
I find that absolutely remarkable.
Thank you.
I find that so important as well. There is nothing wrong with wanting to perhaps outwardly match the age you feel inside. But unfortunately, what you sometimes see, especially in prominent people, is that there's really a mutilation taking place. And you work minimally invasively. How is that to be understood?
That means I'm specialized only in minimally invasive methods, meaning optimization with the latest techniques without scalpel.
Save yourself time searching and researching, and browse our holistic medical database with the integrated Kaisana on Wikisana.
I do not perform surgery. Indeed, I do facelifts, but without the scalpel, all with injection techniques, with very modern methods.
Wonderful. And this also means the person's character is preserved? Exactly.
It is our philosophy to magically remove wrinkles or volume deficits, but to retain the natural character and natural radiance of the face, so that it is not recognizable to the layperson as artificially done. Und so vom Laien nicht als künstlich gemacht erkennbar ist.
Wonderful. And are there limits for you as well? Are there things, have you ever turned people away when it might not be justifiable? Young people who might undergo a procedure due to a self-esteem deficiency. Is that a thing?
Absolutely. There are often requests from patients who would like unnatural results. And that does not align with my aesthetic sense. And I then refuse such procedures and send the patients away without treatment because it is my signature and my name that stands behind the treatment. And things that I cannot reconcile with my aesthetic sense, I also reject.
Nice. And precisely the holistic concept, that is also the Holobiom concept. I find that so important because the skin or everything in general is a reflection of our internal condition, or perhaps also of our burden from environmental toxins or stressful lifestyle that also sets in the system. And if you only change something externally, then it is not sustainable at all. And if someone comes to you with a desire for a change, maybe a wrinkle bothers them or something else is troubling, how do you proceed? What are the first steps?
That's exactly the point, and completely right, Silvia, what you're saying. Outer beauty brings nothing if things aren't right internally. Of course, one can differentiate and must look at the health situation of the individual person who comes to us. And of course, whenever possible, it is the optimal solution to offer the patient a holistic treatment. On the one hand, and this is of course very important, the inner beauty, meaning organ health. And nowadays, the issue is that each of us comes into contact with more and more environmental pollutants throughout our lives. Unfortunately, it is even the case that newborns have to carry the backpack on their first day of life after 10 months. Almost 10 months of pregnancy in the mother's womb, through the placenta, with various environmental pollutants have received on their way. There are over 300 of them, as has been proven and known today. And of course, it is not surprising that early childhood often leads to allergies that cradle cap develops, neurodermatitis or other autoimmune diseases, which then naturally increase further in the course of life. And nowadays we have the great opportunity to effectively put a stop to it with the toxoviris, so to speak. Unfortunately, we can only do it at the minimum weight of 40 kilos. That means we cannot treat children yet per se. But what we can do brilliantly, and this is increasingly the trend, we also have many gynecologists in our practice who are currently planning to have children themselves. And they are all now saying, hey, and rightly so, we are doing a toxopheresis with at least 2 sessions before we enter pregnancy, cleansing ourselves completely and offering our child the best start in life.
That's wonderful, because it is such an important topic and not really recognized by people. And it's great we are talking about it today. What about when a couple wants to have a child? Is it always important for both partners to be treated, or is the focus mainly on the mother?
The primary focus is, of course, on the mother. The father contributes his share as well, but it is a very interesting situation. There is a study that found that there are more and more cases of unfulfilled desire for children among young couples today, which was not the case 20 or 30 years ago. They investigated the cause and found that in young men in their mid-20s to mid-30s, the sperm count used to be around an average of 120 million per milliliter. Durchschnittlich 120 Millionen pro Milliliter gelegen hat. Male infertility is defined at 40 million. Nowadays, measurements show that the average man, young man, only has 60 million. That is half of what it was 20 or 30 years ago. And 60 is not far from 40. Thus, it is becoming increasingly difficult for many couples today. Then there is unfulfilled desire for children. The couples go for artificial insemination, do several there, often sometimes 5 attempts. For some it works, for others it doesn't even then. And now a nice study was done here, and it says young couples with 5 unfulfilled artificial inseminations, with unfulfilled desire for children, we go into the toxophoresis. And both the potential father and the mother, both were cleansed. And of those, over 80% spontaneously became pregnant without any further artificial support.
That's sensational.
So the spectrum of toxophoresis is increasing.
I wasn't aware of that at all. And I also know people who have a desire for children and it doesn't work. And in this direction, they have never been advised. It's great that you're including and doing this aspect. Yes, parents, young parents who want children and are planning need to consider this. How far in advance should the detoxification be done? What is a reasonable interval before fertilization? Do you know that the mother might not detoxify into the baby?
Exactly. Very good question. At the beginning, when a young woman wants children, usually 2 sessions are sufficient. You always do 2 detoxification treatments with a day's break in between. Because in the first treatment, the blood plasma is maximally cleansed of environmental pollutants. We are talking about heavy metals, pesticides, solvents, leftover infections, microplastics, which is a big issue nowadays. We can eliminate all of this with our highly advanced filter membrane. Then you take a day's break, and the body always strives for concentration balance. That means we have 2 areas, the vessels and the organs. And now we clean the vascular system with the first treatment, but the organ systems are still polluted. The body strives for concentration balance, and the following happens in the next 48 hours. The organs become cleaner because the gradient goes back into the blood, and then the blood is a bit polluted again, and the organs have become clean. And now we proceed with the second treatment, clean the plasma again on the 3rd day, and thus achieve about 60 to 70% cleaning of environmental pollutants with 2 sessions, which is a very, very good number. And afterwards, it is very important, there is an accompanying therapy on an off-molecular level with vital substances, with other naturopathic substances, which is done for 4 to 6 weeks because the initiated detoxification process via the machine, via the technical filter of toxophoresis, is continued by the body through the intestines for the next 4 to 6 weeks. And he is supported by us. That means, to answer your question, you should wait at least 1.5 to 2 months after the treatment to then plan the pregnancy.
Very interesting. I have another question on this topic because in the past people often talked about the placental barrier, but today you also hear that detoxification occurs in the child. What is true about that?
Exactly. The placental barrier is a natural barrier to protect the child during pregnancy from influences that are not good for it. But of course, evolution was initiated at a time when it was not known that today we live in an industrial society where there are various environmental toxins and pollutants that now play into this. And recently, studies have been conducted showing, for example, that solvents and plasticizers can indeed overcome the placental barrier, the protective barrier, and end up in the child. Of course, another topic, the child is also burdened by nicotine and alcohol across the placental barrier if the mother does not follow the guidelines regarding these 2 topics during pregnancy. But also, as mentioned, environmental pollutants sometimes find their way across the placental barrier into the child.
Thank you for your explanations. You have also prepared an experiment for us to make it visible. I don't know where it fits in. You can say that because for people who may not be so familiar with toxophoresis, a few more words.
Exactly. I thought to make it a bit more illustrative and visual for our viewers, I brought a small experiment. In the topic of health, the primary life goal of almost every person is to reach a high, beautiful age, but in physical and mental health. And many people want to radiate this beautiful age visually, externally. They always say the 70s are the new 50s and so on. They want to radiate this age of life as well. And be able to enjoy the twilight years with vitality and fitness. Opposing that is what we already mentioned earlier, that nowadays, in 2024, when a baby or a child is born, it is already contaminated with pollutants. And based on this situation and the further development and what our toxophoresis does, I have brought a small experiment or example with me where I would like to briefly explain it so that the viewers can imagine something. The ideal situation, I have crystal clear water here, would be like this. This is supposed to symbolize the body, the human body, organism. That would be the ideal situation. All organs can function optimally. The circulation in the body is optimal everywhere. Life thrives and functions. What is now the situation nowadays? The child is born, first day of life. It has been in the womb for 9.5 months. That has always been quite clear. We heard earlier, over 300 pollutants are accumulated on the first day of life. Over the next years, decades, the following happens to every person. The body develops like this. And often you do not need to be surprised now why the number of autoimmune diseases, other diseases, chronic fatigue and so on. Nowadays, of course, after vaccination, long COVID is a big topic, or after having had a COVID infection. Why more and more people are being affected and can no longer cope with this burden.
The barrel really overflows?
The barrel literally overflows. Some people can compensate for this better because there are genetic detoxification polymorphisms. They mainly talk about the enzyme glutathione S transferase. There are various subgroups, monet, tonepone, and every person is equipped differently. Many are modestly equipped and cannot detoxify well physically. That is exactly the situation you always hear about. The grandfather lived to be 95, smoked all his life, and how did he do that? Another is a non-smoker and gets lung cancer at 45. And that is exactly what is behind it. One has a natural detoxification with glutathione S transferase that works so well, filtering everything out and eliminating it from the body. The other is modestly equipped, and even a small number of harmful substances is enough to shake the whole system. We have now heard that is how the rest of the life develops. The colored water here is a symbolic image of the body's pollution. And now we can compare it with our modern method of toxophoresis, similar to an oil change in a car. Only when the engine is regularly well maintained can it achieve full performance and a long lifespan. It is the same with us humans in a figurative sense. That is toxophoresis. The patient is connected to the machine and all pollutants are filtered out. And then we have the first session, and then we have the second session. For some diseases, you sometimes need more sessions. And over time, we achieve an almost clear situation. Not exactly like at the beginning, but almost clear conditions again by removing all the environmental pollutants here.
Wonderful, vividly portrayed. That stays with us. Thank you very much, dear Sascha. And I believe that it is also very essential to understand that by doing so, you help the body to help itself again, to self-regulate, right?
Exactly. That's right.
And what I particularly like is that you also keep an eye on the vital substances, the micronutrients, everything, and that you give the body optimal support.
Exactly. That's the be-all and end-all, the whole package. Toxophoresis is not just a part, but toxophoresis removes the toxins, helps the body to self-heal, and you remove all the enemies, we call them, the attackers, heavy metals, pesticides, solvents, everything nicely. But now we need vital substances for a body that may have already been affected. Orthomolecular support to offer the organs a gourmet meal for the next period, especially with patients who now come with polyneuropathic complaints where the nerves are affected due to heavy metal exposure and so on. We remove the attacker and at the same time give the best nourishment to the nerve so that it can regenerate doubly well.
May I just ask something about that? Sure, I know many people who, after chemotherapy, have these polyneuropathies, and it's simply said that's just how it is now. It can't be changed anymore. Do you have a different experience there?
I have a slightly different experience because I keep seeing such patients in our health center. And then we interview them and delve into the medical history, which is very, very detailed for us, where we really take the time and go in depth. And then I ask the patients, now they have tingling, shooting pains in the legs, in the fingers, polyneuropathic changes, whether due to chemotherapy, diabetes, or other issues. What has been done so far? What kind of therapy have you been offered? Well, nothing. They said that's how it is now. Do you have any vital nutrients or for molecular support? No. And that's exactly where we also step in by saying the nerve needs for healing, for regenerating, and the body can wonderfully heal and regenerate. In certain areas, it needs our additional support. And we serve him a gourmet menu over the next few weeks, thus providing optimal conditions to start regenerating and also to accelerate regeneration and redevelop beautifully back to function.
Even after a certain time, that's still possible, right? Because people always say if it is like this now, then it will stay that way. I've heard that often from people.
Well, it's always difficult, of course, because we can't assess how severe the nerve is and how long the nerve has been damaged. But it's always worth a try, and then you can see if we've succeeded. Or indeed, rarely. There are also situations where the nerve is already so damaged and you really have your back against the wall. That happens too, but primarily it's always reasonable and makes sense to take a chance. Often you only have part success. But even partial success is better than no success at all. And not having tried it.
You also brought us a great presentation, but it's so exciting and I ask you so much that it doesn't come to that. You have prepared something else for us.
The topic is internal and external rejuvenation of the body, as we have already touched upon, and skin health in resonance with the function of internal organs. It is very interesting. It was established many years ago that every internal organ has a connection to a skin area. And if an organ is affected, not functioning properly, this can be felt in a certain skin area as pain. Or this skin area can also be altered, becoming reddened or getting crusts and so on. These are the so-called head zones, and the skin is our largest organ and one of 4 detox organs. Apart from the kidneys, liver, lungs, the skin is not only a barrier but also a detox organ. And often you can already see in patients, if there is perioral dermatitis or other inflammations on the face, that something is systematically not quite right inside the person, in the organs, and there are high loads of certain environmental toxins. And often you can already bet when such patients come to us, we connect them to the machine, to the toxophoresis, that afterwards in the elode examination, the elode is what we extract in toxins, which can then be sent to the lab for investigation, that things are found that contribute to this disorder, and we can then see wonderfully how the skin regenerates afterwards because the toxins have been removed and also because the blood circulation in the skin improves. Toxophoresis is also called reovaries. Reo means circulation in medical terms, improvement of blood circulation. Because the following happens, the regeneration of the body also improves the blood flow in even the smallest blood capillaries. You can prove this if you want with a dark field microscopy in a before and after image. And with better skin circulation, waste products are removed and more nutrients are supplied. And I also brought along 1 or 2 photos to show this, how something like that looks. Here I have an overview of the hedge and zones where, for example, the areas are drawn in which organs can be found in which skin areas. Now I'll show you the photo of a patient, a lady born in 63, whom we of course optimized aesthetically, medically. But what I want to focus on today is the skin appearance. You can see diffuse redness in the left photo. You can see depigmentation. The skin is not uniform. And by removing the pollutants, you can see on the right side that the skin condition has significantly improved.
That's incredible. If I didn't know it was you, one would think it's retouched.
No, that's actually all. We also put a lot of emphasis on an original before and after photo. I also have another example. Here I just want to focus on the skin quality. With environmental pollutants, burden for decades, 1,957 birth year. And on the right, the skin quality, the skin condition is significantly improved after treatment with toxopheres.
Really remarkable. Really great. Now I already looked at the clock. It's so exciting. Time really slipped away from me a bit. But we are doing another show, and then I can keep asking you because it's so exciting and I'm really quite impressed by your way of working, and I think it's truly unique. And I thank you very much, Sascha, for being with us today.
Thank you very much, dear Silvia.
Dear viewers, how important the inner and outer beauty and health really are, and the health associated with it. And what amazing results you achieve, not only on the outside, but also on the inside, is really perhaps worth further exploring this toxophoresis. I'm already looking forward to future shows and hope you'll join us again. Stay healthy and goodbye.
Thanks for watching Swiss Health Television QS24. Please also visit Wikisana. All shows assembled for you ad-free. And down here we have the button to YouTube, our channel. Please subscribe to it as well. And here a selection compiled for you of interesting shows. All the best. Until another time. Goodbye everyone.